The red pencil is inserted through the veins and into the right atria. Note the superior vena cava and the inferior vena cava. The silver probe is inserted into one of the pulmonary veins. 4 pulmonary veins enter separately into the right atria, 2 veins coming from the right lung and 2 veins coming from the left lung. Observe the aorta and also the aortic arch. This opening is the pulmonary arteries, which are branches off of the pulmonary trunk. The silver probe is within the left atria. In most specimens that you will have in the laboratory, the pulmonary veins will be missing. On the posterior heart, within the coronary sulcus, lies the coronary sinus. It is a vein that brings blood from the coronary circulation into the right atria. This is the heart dissection on the right side. The best way to do this is to locate the superior vena cava in the posterior view. The incision will cut through the right atria, through the tricuspid valve, and into the right ventricle. Follow about a ½ inch parallel to the posterior interventricular sulcus, then a cut at a right angle to the first will run parallel to the anterior interventricular sulcus toward the pulmonary trunk. Next, lift up the wall of the right ventricle. This will describe the heart dissection on the left side of the heart. Locate the left atria on the anterior surface. Pierce through the left atria and then continue through the bicuspid valve into the left ventricle using your scissors, and make an incision that will follow parallel with the interventricular sulcus. Then make an incision approximately at a right angle that will follow the interventricular sulcus toward the posterior heart. So now we're going to look at the structures within the right ventricles. Superior to the right ventricle, above the AV valve, is the right atria. What is being shown right here are the 3 leaflets of the tricuspid valve. Connecting each leaflet to the wall of the heart in the left ventricle are these tendinous cords known as chordae tendineae. Regardless of which leaflet we're looking at, they all have similar features, including the chordae tendineae, which is then connected to an exaggerated extension of the muscle wall known as the papillary muscle. A feature common to either ventricle is this irregular muscle pattern that you can see along the ventricular wall, and this is referred to as trabeculae carnii.